Good afternoon, Savio Perez. Let's begin the warm-up session. What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
Your preparation time is over. Please start your OET speaking roleplay.
Hello Mihiraa, I'm Savio Perez, one of the nurses here in the emergency department. I understand this must be a stressful time for you, especially after seeing Ryan experience a fall. I just wanted to let you know that I've completed his initial clinical observations, and I'm here to discuss his condition with you. Together, we'll work through what happened and make sure he gets the care he needs.
Okay.
First, let me reassure you that Ryan is stable at the moment. His vital signs are within a manageable range, and there are no visible injuries such as cuts, bruises, or fractures. However, I'd like to gather more details about what happened during the fall and explore any symptoms he might have experienced before or after. This will help us better understand the situation and create a comprehensive care plan for his recovery.
Thank you, Nurse Savio. I'm relieved to hear he's stable. It was such a frightening moment when he fell. I'm happy to provide any information you need.
I can imagine how worrying that must have been for you, Mihiraa. Let's go over some details. Could you describe exactly what happened during the fall? For example, did it happen suddenly, and do you know how long he was on the floor before you were able to assist him?
Yes, it happened very suddenly. We were in the kitchen, and he just collapsed. I think he was on the floor for a few minutes before I could help him up. He seemed confused at first, but then he became more aware after a while.
Thank you for sharing that, Mihiraa, it's very helpful. You mentioned he seemed confused initially. Was he able to orient himself shortly after the fall, or did the confusion persist for a longer period?
He did seem disoriented for about a minute, but he knew where he was after that. He couldn't get up on his own. I had to help him.
It's good to hear that he regained his orientation relatively quickly, but I understand how concerning it must have been that he needed help to get up. Can I also ask if Ryan has been able to move around independently since then?
He's been able to walk slowly.
It's good to hear that he regained his orientation relatively quickly, but I understand how concerning it must have been that he needed help to get up. Can I also ask if Ryan has been able to move around independently since then?
Mihiraa, did he show any other symptoms before or after the fall? For instance, dizziness, lightheadedness, or weakness?
Well, he does say he feels lightheaded when he stands up too quickly. I'm not sure if he's noticed anything else.
Now, I'd like to confirm one more thing. Did Ryan experience any urinary or fecal incontinence during or after the fall?
No, he didn't have any incontinence that I'm aware of.
Thank you for letting me know. Mihiraa, I want to start by sharing some reassuring news about Ryan's initial physical assessment. We carefully checked for any visible injuries, such as bruises, cuts, or fractures, and I'm happy to let you know that we didn't find anything concerning. This is a positive sign and indicates that the fall hasn't caused any major physical harm. As for the next steps, we've already completed an assessment of Ryan's vital signs, including his blood pressure, heart rate, and respiratory rate. These readings are currently within manageable limits, which is encouraging. However, we'll continue to monitor him closely to ensure there are no changes or delayed symptoms that might need attention.
Thank you for explaining that. Is there anything I should be doing at home to help him recover?
Mihiraa, I want to reassure you that Ryan's condition is currently stable, and there are no immediate signs of serious injury or concern. Based on his history and symptoms, it's possible that his fall was related to low blood pressure, but we're keeping a close watch on him and addressing his needs carefully. With proper care and monitoring, he should be able to recover well. At home, it will be important to take some precautions to ensure his safety and comfort. Encourage him to move slowly when transitioning from sitting or lying down to standing, as this can help prevent any sudden lightheadedness or dizziness. It's also a good idea to keep his living space free of tripping hazards like loose rugs or clutter, and avoid slippery surfaces that could increase the risk of another fall. If he does feel unsteady or weak, make sure he has support when walking. I'd also like to understand more about the support Ryan has at home. Is there someone who can help him during this recovery period?
Yes, I'm here to help, and our daughter lives nearby, so she can come over if needed.
That's excellent to hear, Mihiraa. Recovery can feel overwhelming at times, but I want to emphasize how vital it is for Ryan to have a reliable support network during this period. Having someone nearby to assist him, especially with daily activities like moving around the house, monitoring his blood pressure, or simply being there for reassurance, can make a significant difference in his recovery. It's not just about physical help, but also ensuring he feels safe and cared for as he regains his strength. Another key aspect of his care plan is scheduling a follow-up appointment. This step is crucial to review how well he's recovering and to investigate if there are any underlying issues, like ongoing blood pressure concerns, that might have contributed to his fall. The follow-up will allow the doctor to tailor his care further, ensuring the best outcome for his health. Before we wrap up, I want to ensure that all your concerns are addressed. Do you have any questions about Ryan's care, his recovery process, or the steps we've discussed?
No, thank you so much, Nurse Savio. I feel much more confident now about how to care for him.
You're doing a fantastic job, Mihiraa. Please don't hesitate to ask if you need anything else. We're here to help.